Hey everybody, thanks so much for joining. This is the Introduction to Dental Therapy webinar hosted by the National Partnership for Dental Therapy. Hope that this is a space for folks who are new to dental therapy, even if you've never heard of what a dental therapist is and are just interested in learning more. We're just really thrilled to have you here. Can I do a quick check on my audio? Can I get a thumbs up if folks can hear me? Yeah. All right. I'll keep on going. Thank you. I'm Parrish Ravelli. I'll be moderating our webinar today. Before we dive in, I just want to go through some quick housekeeping points. We're shooting for about 30 minutes of presentations between our two presenters. If you have questions at any point, please drop them into the Q&A box. If you are having any technical difficulty, reach out to Akil Reynolds in the chat. He'll be able to support you. We will field questions once we get through the two presentations, but don't hesitate to drop them in at any time. We'll take the slides down towards the end and have more of a discussion. We are recording the webinar today. We'll share it out as a follow-up piece with anybody who registered. And we'll have all of our organization's contact information at the end in case you want to connect after the webinar in the future. Before introducing our speakers, I do want to do a quick introduction of the National Partnership for Dental Therapy. We are co-chaired by 4 organizations: Community Catalyst, the National Indian Health Board, the National Coalition of Dentists for Health Equity, and the American Dental Therapy Association. Our goal is to elevate the visibility and broad multi-sectoral support for dental therapy as an evidence-based way to improve access to oral health. I invite you to check out more at dentaltherapy.org. The website will be up at the end as well. I want to get going and introduce both of our speakers. First up, we have Claire Roesler. Claire is a dental therapist and a board member of the American Dental Association. Claire holds a dental hygiene and dental therapy degree from the University of Minnesota and was the first dental therapist to be licensed in the state of Maine. After we hear from Claire, we'll hear from Laura Brannon, who's the dental therapy project manager at Community Catalyst, where she oversees really all of our efforts to support the authorization and implementation of dental therapists across the country. Before this, Laura worked for the Pew Charitable Trust supporting state-based campaigns. Again, my name is Parrish Ravelli. I work with Laura at Community Catalyst on the Dental Access Project. I'm really excited just because there's so much knowledge and expertise on this panel. Let me do a quick point of correction because I feel like it's important. I misspoke. Claire is a board member of the American Dental Therapy Association. Important distinction, apologies. Again, if questions come up during the panel presentations, then drop them in the Q&A and we will get to them after we hear from Claire and Laura. All right, I'm gonna turn it over to Claire. Welcome and looking forward to hearing more.
Thanks, Parrish. So yeah, thank you for taking time out of your Friday afternoon or morning, wherever you are, to learn more about dental therapy. I'm just going to be going over some general ideas about dental therapy, as well as the education and then some of the states that dental therapists are practicing in. So what are dental therapists? This is a question that I hear quite frequently when I'm talking about my job. And dental therapists have been practicing in the United States for almost about 20 years. And they are licensed oral health professionals that work under the supervision of a dentist. A big part of dental therapy is the dental therapist collaborating with the dental team and the dentist to best serve patients and increase access to care. We provide preventative and routine restorative care, and I'll be going into some more details about the scope of practice in a few slides here. We work in all different types of settings: private practices, community clinics, rural areas, tribal settings. So there's many different areas that dental therapists are practicing in today. So our dental team is changing. On the left here, you'll see what most patients and what most people are familiar with when they think of a dental team. You have the dentist, you have the dental hygienist, and you have dental assistants. On the right, there's many different types of dental careers that are in practice today. Dentists are getting more specializations. There's different things that dentists can go on and do, like endodontics, cosmetic dentistry, oral surgery. And then there's our dental hygienists who are also practicing in many different types of settings, as I described before. Dental hygienists are also able to go on and receive types of specialization that allows them to practice in different settings. We have our dental assistants who work directly with the dentist to provide care. And then we also have expanded function dental assistants who have received more training to be able to provide, placing fillings or placing different types of materials and procedures. So that's another type of different dental assistant, new member of the team. We have our dental therapists, of course, what we're talking about today. We have care coordinators and medical providers, and you're starting to see more types of dentists or dental hygienists in medical settings as well, which is really exciting to see more medical and dental integration. So as I mentioned before, I'll be talking a little bit about what can dental therapists do. On the evaluation side, we're talking about doing x-rays, providing exams, checking patients at their routine hygiene visits, but also providing limited exams like emergency type care where a patient comes in with one specific concern. A dental therapist can start to kind of direct that appointment and then give the patient to the dentist when needed or provide treatment when it falls within their scope of practice. We also do treatment planning, and that can be done in collaboration with the dentist. And then we also provide referrals when needed, whether this is a referral to a dentist or to a specialist such as oral surgery or endodontics. We also do prevention care like cleanings, sealants, fluoride varnish to help keep our patients healthy. And then we also do fillings. This can be any type of filling, whether it's composite, amalgam, back tooth, front tooth, different types of filling procedures. We can also place temporary crowns. A lot of times this is the stainless steel crowns on children, extractions of baby teeth, and then extractions of permanent teeth. A lot of times these teeth are periodontally involved, meaning that they're mobile of some sort. And then we can also dispense and administer non-narcotic medications and provide local anesthesia for procedures. As I mentioned before, dental therapists can work in multiple different types of settings, and they can work under different levels of supervision, whether this is the dentist on site or the dentist, you have your collaborative management agreement with the dentist and you're able to go to a satellite clinic or a school or a nursing home under the general supervision of the dentist, meaning that you have an agreement with them of what you can and can do within your scope of practice in what type of settings. So we work under the standing orders from the supervising dentist under what's called the collaborative management agreement, and then we can collaborate whether it's needed to be telehealth or the dentist is on site. We can work in private practices, federally qualified health centers, mobile dental clinics, satellite clinics, school-based clinics, nursing homes, as I mentioned before. And this really helps increase access to care because dental therapists are able to go out into these different types of settings and provide care where it's needed, not just that typical private practice of a lot of times what people think of in standard dentistry. It's kind of changing the game, able to go out and help patients where needed. We're able to do this with portable equipment, and we can also travel to schools, provide assessments where needed, and then also nursing homes, groups homes, etc. So as I have mentioned, we have the dental clinics and then the nursing homes. We also have schools and emergency rooms because dental therapists are so mobile and we could go out and provide assessments and limited care. We're able to see more patients. I've had an opportunity to go into schools and help see kids and provide assessments, whether these kids need sealants or not, to help provide some preventative care. And then if we see something that maybe needs a little bit more treatment, we're providing that patient and that parent with a referral to where that child is able to have the care that they need. So that's what we mean when we say prevention. We can help provide the care that's needed, like the preventive type care. But if the patient needs more care than we're able to do in these mobile type settings, then we can refer to them a place where they are able to have that completed. So where are dental therapists being educated? The Commission on Dental Accreditation sets the standards for all dental therapy programs. It also sets the standard for dental school programs for dentists and hygienists and dental assistants. Our program must be at least 3 academic years. CODA does not require a specific degree for dental therapists, although some degree programs can vary. So it can be associate, bachelor, or master's level program. Some education programs, like the one I completed, combine dental therapy and dental hygiene, while others focus on dental therapy alone. Some states also require that dental therapists hold a dental hygiene degree, but we are trending away from that dual license, that you don't necessarily have to be a hygienist to be a dental therapist. Dental therapists have been working in the US for 20 years. There's dental therapists practicing outside of the US as well, in Europe, Australia, New Zealand. So this isn't a new concept, just maybe a little bit newer of a concept in the US. We have 5 states where dental therapists are practicing, and then other states where dental therapists are authorized to work in some different settings. And there's around 200 dental therapists in the US. And I'll show you a map of those states at the end here. So these are where the education programs are located. There's 1 in Alaska, 3 in Minnesota, and then 1 in Washington. And very exciting that there's more in development. There's a lot. I've had the pleasure of meeting a lot of people who are interested in becoming a dental therapist. And the biggest thing is, getting those people the education and access to the education programs that they need to become a dental therapist. So currently, these are the 5 places that are educating dental therapists, and hopefully more soon. And this is the map that I mentioned. The states in orange are where dental therapists are authorized to work in some or all settings. And then the blue states are states that are working towards providing legislation so dental therapists are able to practice. And I'm going to hand it over to Parrish. Thank you.
Thanks so much, Claire. Really appreciate all of the context and the specifics about what a dental therapist is, what a dental therapist looks like, what they can do, where they can work. Really helpful and important to have you here as a dental therapist and as a part of the ADTA. So now I'm going to turn it over to Laura, who is going to talk a little bit more about the impacts, the broader narrative around dental therapy as an opportunity for communities, for states to pursue and pursue oral health equity. Laura, take it away.
Thanks so much, Parrish. And Claire, thank you for that amazing act to follow. I always love getting to present with an actual dental therapist. It always makes such a difference to have somebody who actually does this for a living and get to a real dental therapist. They're not unicorns. So really glad to have you here with us. So one of the questions I get for people frequently is, okay, this kind of makes sense, but like, why does it matter to me if I'm not a dental provider? And to be clear, I work for an organization that works for health justice and does policy change and community organizing. For health justice, we don't exclusively work in dentistry, and generally really technical dental workforce issues wouldn't be our jam. Except dental therapy is actually a way to increase access to care for people, particularly people who are the least likely to be getting care currently. So it is a policy that advocates from really all walks of life from around the country have really gotten excited about. I think that this is sort of one of the rare, what I kind of think of as common sense bipartisan solutions, an idea that has support from across the political spectrum, across the country geographically. I like to joke that there aren't a lot of policy ideas that Bernie Sanders and Grover Norquist agree on, but this is one of them. So speaking about where did all of this come from, like Claire mentioned, dental therapists have been in the US for almost 20 years now. They've been working globally for over a century. So where did this big push in the United States for dental therapy come from? Well, it really came from communities. It didn't come from sort of the dental establishment. Communities, specifically originally Alaska tribal communities, wanted better access to care, but they didn't just want more of the care they were getting, which was frequently sort of itinerant dentists, people coming through, focusing on sort of triaging before moving on, not having regular access to care. So they said, you know, we want better care, but we really want people who are actually going to have be here sort of year round, not just once or twice a year. We'd really like it if it was people who understood our community, even people from our community. How do we make sure that we actually have a dental workforce that understands our community and is part of our community and doesn't feel like it just comes in to sort of triage dental cases briefly and then leaves? And so they really struck upon dental therapy as a way to create an educational pathway to educate folks from their communities in the most needed care who could work alongside their dentists and dramatically expand access to care. And this was not just an Alaska problem. You know, access to dental care is a problem all across our country. So looking sort of broadly, what's wrong in oral health? Just a couple of high-level notes, and I think we could do an entire webinar on just what's wrong in oral health without even touching upon a solution. So we're just going to do this briefly today. A couple high-level notes is about 70 million people in the United States live in areas that the federal government has designated as having too few dentists. Less than half of kids covered by Medicaid each year get dental care. And about a third of adults from surveys report having skipped dental care due to cost. And of all the different kinds of healthcare that they surveyed, mental health care, behavioral health care, you know, medical, all different kinds of medical care, dental was the single most common kind of care that was skipped. In general, you know, we have a safety net that is drastically overburdened. And we have a system that frequently people have to rely upon charity care. We have a photo here of a Mission of Mercy event, which is, you know, a beautiful thing that dental providers do to volunteer their time, but a once a year event in like an arena is not an actual system of care. You know, very similar to that situation in Alaska where they had sort of only brief emergency care. That's what we're really getting when we have these large portions of our population who have to rely upon these sorts of charity care events, or who have to go to the ER. If you can't have your cavity treated when it's small, you have to wait until it's an emergency and you go to the ER and get, you know, an antibiotic and a referral to have your tooth pulled. If we could treat these problems much earlier, we could not only save the healthcare system money, but we could improve the oral health of our community. So I like to talk about the AAA aim, which many people are probably familiar with if you're in health policy. I think this was originally Don Berwick's concept, talking about the triple aim of a good healthcare solution should be about improving patient experience, improving the value for money, and improving population health. And I think dental therapy is a great example of something that can achieve all three of those legs of the triple aim. You know, research shows that adding dental therapists to the dental team can make care more accessible. It can make it more cost effective to deliver, and it builds a more representative workforce, which we know leads to better outcomes for patients. So I'm going to go through a little bit of the research. Sort of putting this together, I thought about what are the questions that people frequently ask me about dental therapists. And the first question I always get is about safety and quality, which is totally understandable. People say, well, you know, if I'm used to getting a certain amount of care, a certain kind of care from a dentist, and now I'm getting it from someone else, I'm getting it from a dental therapist, am I getting worse care? And the answer is no. You know, just like in medicine, how there are a lot of different members of the medical team, nurse practitioners, physician assistants, there's a lot of different people you might see for different circumstances. I can tell you, I recently fell and had hurt my foot, and I had to get an x-ray on a Saturday night. And I went to an urgent care near me, and a very nice PA saw me and took an x-ray and told me my foot wasn't broken, which was great news for me. if I had that urgent care probably wouldn't have been open at like 8 o'clock on a Saturday night if it was staffed by doctors, because financially that probably wouldn't have been feasible. Most urgent cares are heavily staffed by NPs and PAs. So that for me made the care more accessible. It also made it cheaper for me because it saved me from having to go to the ER and pay ER rates to get an X-ray on my foot. So, you know, similar to how NPs and PAs have really made care a lot more accessible and affordable for a lot of people, dental therapists, I think we're seeing, can really do the same thing on the dental side. But at the same time, it is the same quality of care. So when dental therapists are trained, they're trained to the same standards as dentists for the procedures which they are trained. And I know we can ask Claire more about this during the discussion, and I'm sure she can tell us a lot about it. But from what I understand, dental therapists spend as much time, if not more time, on the things that they do a lot in their training than dentists do. Dentists generally are trained about 500 procedures, dental therapists more like 75. They're going to have a lot of time to focus on the things that they do. And multiple blinded studies have shown that when dentists evaluate pictures of restorations, that's a filling, done by dentists and done by dental therapists, and rate them on their technical ability, on how well the procedure was done, they rate the work of dental therapists as good, if not better, than that of dentists. And they've done some large scale studies on this. And one of the researchers who did this told me he was initially quite surprised until he realized if you do one thing all day, every day, you're going to get really good at it. And dental therapists are really experts in doing fillings. It's something that they spend a really large percentage of their time doing, a much larger percentage of their time than most dentists spend on fillings. So, you know, this is a technical hand skill. And so if you do it a lot, you're going to get really good at it. You know, the American Dental Association's own Council on Scientific Affairs found 10 years ago, that appropriately trained mid-level providers were capable of providing high quality service, which is absolutely true. And the Commission on Dental Accreditation, which is actually housed within the American Dental Association as well, it's the entity that has permission from the U.S. Department of Education to accredit all dental education in the U.S. So them creating dental therapy standards and then beginning to accredit dental therapy programs. So far, I believe there are 3 accredited in the U.S. Really speaks to the high level, the quality that those programs provide. They are evaluated to the same standards that CODA evaluates dental schools, dental hygiene schools, and dental assisting schools. So one of the important things I know Claire touched upon is dental therapists' ability to bring care into the community. And one of the reasons they are so able to do that is their cost effectiveness. Generally, a dental therapist will cost about 1/3 to 1/2 the amount to employ of the cost of a dentist. And so, you know, already we have hygienists and FDAs, standard function dental assistants, doing a lot of care in community settings. But generally, they're really only able to do sort of preventive care. And due to the high employment cost of a dentist and the fact that when you're working in community settings, you're going to have like less productivity in terms of like number of billable procedures per hour. It's just usually not cost effective to send a dentist into these places, especially when you think about travel time and the time it takes to set up your portable equipment and all of that. And the fact that some of the things dentists are doing are going to be more complicated and that can't be done with portable equipment. So they're really only able to do simpler things like maybe a filling. So the great thing about dental therapists is that because of that lower cost of employment, it can be cost effective to have them work in those community settings. And you know, I think like Claire talked about earlier, you know, sending a dental therapist into a school, you know, they can provide some care there. You know, depending on the equipment they have, they may have to refer for restorative care, or they may be able to do the restorative care right there in that school, and only refer out if the child needs or if the adult needs something that only a dentist can do. So a lot higher percentage of patients are able to have their needs met right where they are. And this is particularly important for patients like people with special needs, seniors who are in settings like long-term care, kids in schools, kids in Head Start centers, who are going to have some challenges sometimes getting to the dentist's office. I borrowed a graphic here from an organization in Minnesota called Children's Dental Services, which is an amazing big safety net provider. And they have been a huge champion of dental therapy from the very beginning. and employ a number of dental therapists. And many of you may have heard their executive director, Sarah Wilp, just speak before, talk about how it's really dental therapy that has allowed them to expand into so many community settings. I believe they currently have one brick and mortar clinic in the Twin Cities. And yet in 2020, they provided care in 711 sites being a school, a nursing home, a preschool, 711 sites around the state. And, you know, this is an amazing thing for the state. So many more people are able to get care where they are. So I think that's one of the things that's sort of possible with dental therapy. You know, so one of the things I also think is really important is talking about how dental therapy can be a pathway to bringing more people into the dental profession. Realizing that expensive degrees and high degree requirements can be a huge barrier for a lot of people, particularly people who are from low-income families, or people who frequently are people of color, people who somehow have faced barriers to accessing higher ed in their lives. So, you know, the original first dental therapy program in the US was conceived by Alaska tribes as a pathway to find a way to help their Alaska Native people become dental providers for their communities. And it was really designed as a program that met students where they were. They took 3 academic years of training and put it into 2 calendar years, realizing that actually worked better for people. Frequently, these were people who had already had other jobs and were going back to school, so they might generally be considered a non-traditional student. A lot of them had families. And so having less time out of the workforce, less time not earning a salary, was hugely important. So being able to get through that training more efficiently. You know, dental therapy also creates a good paying job frequently in communities where sometimes those are thin on the ground. And, you know, we also have just a tremendous amount of research in healthcare generally that patients do better when they receive care from a provider who understands their culture and their community. So, you know, and I think this is also really important to, like, this isn't just about, you know, Native people want to be able to have Native providers. This is a pathway for people from communities all over, whether you're from, you know, Northern Maine or Southern California. There are a lot of people who have faced barriers to accessing education due to cost, due to time. You know, as somebody from the Midwest, rural communities very often struggle to retain providers, particularly when young people move away and they don't come back. And, you know, programs like dental therapy can be a pathway to make accessible education that allows people to stay in their home communities. So I do often get questions about, well, how does this affect dentists? Which understandable. And the answer is adding dental therapists to the team is great for dentists, and it's great for other members of the team, like hygienists and assistants as well. Adding dental therapists to the team can make the whole team more effective and more efficient. Clinics that have hired dental therapists report being able to treat more patients with the same budget and be able to do a lot more care in the community, like we talked about with that clinic in Minnesota. Private practices said that they actually generated larger profits, even while treating more folks who were covered by Medicaid. And, you know, dental therapists can staff rural clinics, keeping them open full time. You know, in a lot of rural areas, I'm sure Claire can talk about her experiences in Minnesota. In a lot of small towns, there might be a dental clinic where they can't find a dentist anymore to be there full time. And so, you know, maybe the clinic's only open a couple days a week. And this is an option for a dentist to say maybe has more than one clinic, to be able to have one clinic staffed most of the time by his clinic staffed most of the time by a dental therapist, and you know, him or her be able to move between them, so that they're there for patients who need things that specifically they can do, but those clinics are open much more, being able to provide more care to the community. And, you know, this is made possible by the fact that, as Claire talked about, dental therapists can work under off-site supervision and understanding orders while still being supervised and collaborating with those dentists. And also just generally having a dental therapist there to do things like exams and fillings means that dentists can focus their time on more advanced work. So they're going to be doing more crowns and bridges, which a lot of dentists have said to me they quite frankly enjoy more. They like doing those sort of more what they would consider interesting things, more challenging things, which I've also had a lot of private practice dentists tell me are more profitable. So that really supports that part about it being good for the bottom line. I think most importantly, dental therapy is good for patients. There have been a lot of studies done that show that adding dental therapists to the team decreases the wait time and travel times for appointments. So patients are able to get care more easily when they need it, where they need it. More people are getting care in those community settings. There have actually been an evaluation that showed that in communities that previously had really poor access to oral health care, but then had a decade of regular access from a dental therapist, that fewer people were experiencing tooth decay. More kids were entering kindergarten with cavity-free teeth. More people in general, including elders, were keeping their natural teeth. A lot fewer people were needing those extractions, particularly as we talked about if you've got a little cavity that a dental therapist can fill early on, as opposed to that waiting until it becomes an emergency that ends you up in an ER and you just really have only the choice of getting your tooth pulled. That's a much better outcome for the patient. It's also a savings for the healthcare system. And also finally, more providers from their communities, as we talked about. Patients really appreciate having a trusting relationship with their provider, and having a provider who wants to stay in that community long term, a provider who understands that community, can be really important for the outcomes of patients. And I will hand it back to you, Parrish. Thank you.
Thanks, Laura, and thanks again, Claire. Quick ping for folks to put any additional questions that have popped up in the Q&A box as we dive in and respond to some of these. First, I just want to show some appreciation for both presentations, touching on so many, we're in a 101 introduction webinar, but touching on so many different topics, from re-envisioning the dental team, rethinking how and where care can be provided. I really appreciate the context of taking care to people, to communities, the thinking about cost efficiency and the triple aim, and then what feels like a line or a thread that can be drawn through all of this is really innovation that is grounded in health and racial equity, that is grounded in what the community needs and what the community wants. So just a huge appreciation. And so let's dive into some questions. Let me take this slide down. All right. So first, there's a couple technical questions. I'm going to try and bundle a couple of them and toss them to you, Laura, and then see if there is additional things to add. So one, how many programs have been accredited by CODA is the first one. And then I wonder if you could speak to sort of diagnosing. Are dental therapists doing diagnosis, or is that still living with the dentist in places where dental therapy is being implemented?
Sure. So first of all, there have been 3 dental therapy education programs accredited by CODA so far. You may have recalled from Claire's slide earlier that there are 5 dental therapy education programs in the country, and you may say, I don't understand. And the answer is that there were dental therapy education programs before CODA created its standards. It created its standards in response to the success of dental therapy in the US. So those older programs are now going through the process of getting accredited. And there's been 1 new program that's opened. It was initially CODA accredited, and then the other programs are applying as operating programs. So far 3, but I'm sure all 5 will be soon. And there are a lot of other schools around the country in states that recently passed legislation that are working on creating a program. And then you had a question about diagnosis, which is a slightly fiddly answer. The answer is that dental therapists in most states are allowed to do exams, assessments. They're allowed to create a resulting treatment plan based on what they saw within their scope of work. So if you can do, and I'm sure I'm going to ask Claire to speak to this in a second, but if you can do an exam and then you can create a treatment plan, it's sort of implied that you need to be able to diagnose. Dental therapists in most states are able to work without a dentist having examined that patient first, which is really important, both for cost effectiveness and for the effectiveness of actually getting care to those patients. A number of statutes don't actually involve the word diagnosis. I think that was more for political sensitivity reasons. But dental therapists in almost every state are able to do, exams and create treatment plans. And then if those treatment plans are within their scope, and if that all falls in line with their collaborative agreement with their supervising dentist, are then able to implement them. And Claire, did I get that right?
Yes, you did.
I was
going to say, you answered that perfectly. I think you touched on it really well.
Awesome. So I want to come to you and tap into some of your wisdom as a dental therapist. Wonder if you've encountered any sort of skepticism from other providers, dental or non-dental, about your role as a dental therapist, in how you responded. How did you sort of counter the skepticism that you may have received?
Yeah, I think that was one of my biggest concerns when I moved out to the state of Maine in pursuit of becoming the first dental therapist there was, what type of skepticism am I going to receive from other providers, from, even hygienists as well. I totally understand any type of misunderstanding. Dental therapy is a newer concept to a lot of people. So I think it's okay to just kind of have some hesitancy when there's something new. So many of the dentists that I encountered just had a lot of questions and maybe questioned it at first, but then once I started working with them and they saw me in action and heard a lot of my education and background, a lot of them, or most of them, were really on board. And I had many other dentists in Maine reaching out to me wanting to hire a dental therapist once they found out what I can do, what I'm trained to do, and how I can benefit their practice and their patients. So I think most of the time when there's something new, people question it. But once you hear about it and understand it, I think everyone's on board.
I just want to add, I think it's interesting because, Minnesota was the first state to pass legislation authorizing dental therapists. It was authorized in Alaska under federal law for tribal communities. So Minnesota was the first state that passed that legislation. And at the time, it was very controversial. And I know the Minnesota Dental Association was active fighting against that legislation. I have to say, and Claire, I wonder if you would agree with this. I feel like most of the complaints I hear about dental therapy from dentists in Minnesota these days is that there's not enough of them. Is that there are so many offices that want to hire dental therapists that there aren't enough of them. And they're like, when are more going to graduate? Come on, let's go.
Yeah, I think we're, the new graduates are really lucky that they're in a time that there's more jobs than there are dental therapists. So they're in a really great position where there's so many practices that are interested in hiring a dental therapist to their team.
And one point of clarification, again, from a question that around the educational requirements, are they currently the same for students with a hygiene degree and for non-dental students in terms of the educational requirements?
Me to take that one?
Yeah, sorry, Laura, let's go to you first.
Okay, so I can say, so to the National Code of Standards, so national standards do not require that a dental therapist also be trained as a dental hygienist. They consider them separate professions, but the dental therapy standards do recommend that advanced standing be given to qualified students, so whether that's a dental assistant or a dental hygienist. It's up to states how to actually decide to create their licensing laws, though, and some states have required that dental therapists also be licensed as hygienists. I think it is a minority of states. And we're seeing them move away from that in the states that have passed recently, due to some, I think realizing that there are some downsides to that requirement as well. Then it's, I think, ultimately up to the schools, and some schools, like where Claire went at the University of Minnesota, they combine those two training programs. So you can do a dental hygiene program alongside a dental therapy program. I know there are also two programs in Minnesota that specifically focus on advanced standing only students, so people who already have a dental hygiene degree. Now, there are also two other programs in the US that just focus on dental therapy. And so it really depends. I should also just say, from my perspective as somebody who works on this in advocacy, I always recommend folks not add extra requirements to statute. If you look at a statute for how a state regulates dentistry or dental hygiene, it just says graduate from an accredited program. I always really recommend that folks do the same for dental therapy, because I think that then leaves choices up to schools, up to students, up to employers, and people can decide, like a school can decide, you know what, I really want to combine this with my dental hygiene program. I think that makes sense. And then that school can make that decision. Or another school may decide, you know what, I don't want to. I want to do this standalone. And students can figure out what's the right fit for them. Employers can figure out the right fit for them. So if that's the answer, I hope that answers your question. The answer is it's not required by national standards. And there's some variation in state law. And then different schools handle it differently.
Thanks, Laura. And a question that taps into something you mentioned earlier, Claire, and again, coming back to your role as a dental therapist within a broader team, I wonder if you have had any experiences or have any insight into working on a team that isn't used to having a position, and in particular, like what recommendations would you have for a dentist who this is a new experience with? What are some things that help and sort of facilitate the process, or even things to avoid?
Yeah, I think that we've been lucky that there's a lot of resources out there now of how to add a dental therapist to the team and how to best utilize a dental therapist, and reaching out to those teams that do have dental therapists and kind of what they've learned through that process of, how did we make this better? What did we learn from our past experiences? But then also utilizing those online resources that are out there now is really the best way, I would say, to go about it. And then also utilizing the dental therapists themselves and the training that they've had. What can you do? What do you like to do? How can we make our schedule the most efficient to help, see these patients?
That's great, thank you. And then Laura, you mentioned policy, you mentioned advocacy. I wanted to bring in a question or that I think relates to that. And so thinking about policymakers, and the question was about Medicaid policymakers, but I also just think generally about policymakers. What do we think the opportunity is for them to play a role in sort of advancing dental therapy? If we had a policymaker right here, what would we say our priorities are?
Yeah, so I think it varies a little bit whether we're talking by state or by federal. Dental therapists, just like most other professions, are regulated at the state level. So that means states have to authorize them, and they create all the laws regulating the profession. So, if it was a state policymaker, a legislator, I'd really encourage them to look at the evidence. There's some great resources, like there's a Dental Therapy Model Act, which I think is a tremendous resource, and we can share as a follow-up, that sort of looks at best practices and looks at the evidence around this and looks at what has really worked in other states. And really sort of, I would say, following the evidence is really a great way to make sure you're going to have a dental therapy program that is as effective as possible. I think you really want to build in that flexibility we talked about, like, with letting students and educators and employers make some decisions, like dual degrees or not, for themselves. But also, that those laws that ensure, the high quality that we absolutely want dental therapists to have. Specifically for folks who work in Medicaid, I think that this is a tremendous opportunity, and I'd really encourage them to look at how dental therapy has helped Medicaid populations in a number of states. There was a study recently that came out that showed, like, adding dental therapists to the team in Minnesota resulted in more people who were low income and on Medicaid getting care in the state of Minnesota over a period of time. And it was a peer-reviewed study that recently came out, which was really impressive. So, I would say really encouraging them to look at that, to make sure that dental therapists are able to bill Medicaid. They can in really every state, but occasionally there is just some administrative barriers that have to be figured out, and we just want to make sure that those are minimal as possible. I will just say, just talking policymakers in general, I really think, you know, there's also a lot of opportunities on the federal level. The federal government has a lot of programs to support health professions, including dental health professions. And I think including dental therapy in those sorts of programs is really important. There was a federal advisory committee report that came out last year from the, I always mess up this name, but I'm going to try, the Advisory Committee on Training in Primary Care Medicine and Dentistry, which is the committee that advises the Health Resources and Services Administration, HRSA, on basically its health workforce programs. And they actually devoted the entire report on dental therapy, which is the first time they ever did their annual report devoted to a sole profession. And it really looked at the evidence around dental therapy, found that there was really strong evidence for dental therapy as a means of expanding access to care, and recommended that the federal government add dental therapists to existing programs and specifically devote resources to really expanding dental therapy education. So I thought that was tremendous, especially when you have a federal advisory committee of experts looking at this and saying, you know what, like from a non-biased, multi-healthcare lens, we really think that there's strong evidence here and this is a good investment. So I think there's so much policymakers can do.
Agree. Thank you so much for that context. So we're going to get into the weeds just a little bit here. I know we're in an introduction webinar, but want to dive into at least one of these more clinical questions. So we mentioned earlier about the quality of fillings from dental therapists. Question I think is looking for more of an explanation about more of the specifics around who is cutting and gating the live tissue, the tooth, etc. Wonder if you could talk a little bit more about that, Laura. I open to both of you, but Laura, I think let's start with.
I'll hand it to Claire, but generally I think the Code of Standards set a minimum scope that all dental therapists have to learn, and that those standards include preparing and placing restorations, just broadly preparing and placing restorations. Like you actually do this every day though.
Yeah, I think there can be some confusion when it comes to who is prepping the tooth or drilling into the tooth. Now that we have restorative function dental hygienists and expanded function dental assistants, they are able to place some restorations, and a lot of times they think I would have other professionals or even patients be confused about what the difference is between those type of providers and a dental therapist. So expanded function dental hygienists or expanded function dental assistants and restorative function dental hygienists would come in after the dental therapist after the dentist has prepped the tooth and then place the filling. A dental therapist, we're able to complete the procedure start to finish, meaning prepping the tooth and placing the restoration.
Thanks, Claire. Appreciate that. I think one last thing I want to touch on before we wrap for the day. Laura, you mentioned, and I think it was sort of woven into a lot of your presentation, and I think there's this ongoing discussion around cultural competency within care. I mean, I think this is a broad discussion with the healthcare field in general, and I think it has some specific intersections with dental therapy too. I wonder if you could talk more about how you see dental therapy and the role of dental therapists sort of supporting this broader push around cultural competency and in people receiving culturally competent care.
Yeah, I think there's been a tremendous amount of work done in the past couple of decades in healthcare broadly, and some of it's been done in dental specifically, but I think we can really learn from the broader experience of the importance of providers or patients having providers that they feel safe, that they feel comfortable with, that they feel respected by. Obviously, you know, our medical professions tend to be more white than our population. This is especially true in dentistry. The communities that are having the least access to care, not coincidentally, are also frequently communities of color and tribal communities. And, you know, this is due to, you know, systemic reasons. And so it can be really, I think it can be really important for patients to have providers who they feel speaks their language or who understands their culture, who they just genuinely feel comfortable with. You know, there have been like studies in medicine that show that patients can have better outcomes when they have a provider who does, you know, understand their culture. You know, implicit racism exists throughout our society, and it influences healthcare as well. So, you know, the importance of having a diverse workforce is really important. But, you know, I also sometimes think that people think that cultural competency means like teaching someone how to work with a community of color, how to work with an immigrant community or something, when I think what it really means is like understanding your patient base. And, you know, I am from the Midwest, and my dad told me a funny story that one of his doctors told him once that they live in a larger city in the Midwest that has like the big regional medical center. And his cardiologist told him a story recently that his cardiologist, I think, was originally from Greece, and that when he'd first gotten there, he'd had a patient come in who was a farmer, and it was like fall, it was harvest season, and so you'd expect him to be out in the fields, and yet this guy had driven like 90 miles into this big medical center and was reporting like, I think like some chest pain or something along those lines. But originally the doctor didn't understand why everybody was like, oh, this is really, really urgent. Because if you don't understand anything about Midwestern farmers, you don't understand that like a little bit of pain for a Midwestern farmer is like a 10 to anybody else. And that if you've got a farmer who decided to like stop, you know, harvesting his fields to drive 90 miles away to the big city when you need to be taking your crops, like that had to be a pretty good reason for him to do that. And, you know, this doctor is basically saying, when I got there, I didn't understand that context about the patient. Like, and that right there is cultural competency too, like understanding, you know, these ways we all communicate in so many ways other than our words. So understanding, you know, what our patients are really telling us is hugely important.
Thank you, Laura. Well said. So we're going to close out for the day. I just want to say huge thanks to our panelists, Claire and Laura, for the conversation. Huge thanks to so many folks for showing up and listening and bringing some great questions and discussion points. I am going to bring the slides back up, I think. Can you see the slides?
Mm-hmm.
All right. So want to leave you with some follow-up information. We would love to continue this conversation. No, clearly there were too many questions for us to get through today, so please don't hesitate to reach out. There's tons of more information at our website, which is dentaltherapy.org. Also want to make sure you have contact information for the other co-chairs of the National Partnership. And I also just want to put a bug in your ears for May, when we will be hosting another webinar talking about dental therapy as an economic justice issue. We're really excited about that one. Hope everybody has a good rest of your day and a good holiday weekend, and we will talk with you soon.